Good afternoon, and welcome to the Ohio Commission on Minority Health Certified Pathways Community Hub Grant Fiscal Year 2020 Application Technical Assistance Session. For those that are new to the Commission, in 1986, the Governor's Task Force on Black and Minority Health was established to determine why there was such a great degree of health disparity between the minority population in Ohio and the majority population, and what could be done to remediate that disparity. In 1987, the task force concluded with a final report that called for the establishment of the Commission on Minority Health. Through amended substitute House Bill 171, the Commission commenced operation on July 1st, 1987. The Commission funds projects that are innovative, culturally sensitive, and specific toward the minority population. No one is turned away for race and ethnicity. However, the focus is on the minority population and the reduction of the incidence and severity of diseases and conditions that are responsible for excess morbidity and mortality in those same minority populations. Our overall grant focus is on health promotion and disease prevention, and that constitutes the primary focus of the Commission's funding. Furthermore, within those minority communities, those that are economically disadvantaged are also target populations. Minority groups that the Commission serves are defined as follows: African Americans, Hispanic Americans, Native Americans, and Asian Americans. Grants will be funded to target those populations on a competitive basis for community-based organizations with a valid and active 501c3 designation and status. The only exception to that particular line would be those that are governmental health departments, such as a regional health, combined health district or a local health department. Furthermore, organizations that seek funding from the Commission must abide by our Chapter 3704 Administrative Code. With regard to our hub funding background, in 2000, the Commission provided seed funding to support the Community Health Access Project, from which the Community Pathways Hub model was born. That particular program was very rigorously evaluated and soon became an evidence-based program, which we funded through our demonstration grant funding at that time. Upon learning of and understanding the evidence-based nature of this program, through amended substitute House Bill 64 in fiscal year 2016-2017, the Commission initiated a funding request for $4.1 million to right-size, expand and replicate the Certified Pathways Community Hub model. However, the Commission was approved for $2 million to expand and replicate that same model. The Commission is now in our second year of the second biennium of the Certified Pathways Community Hub funding, which I will now abbreviate to just HUB. But in any instance where I mention HUB, I am specifically referring to the Certified Pathways Community Hub model. For the 2021 biennium, we are presently going to allocate and initiate the Certified Pathways Hub Model Expansion Replication Grant once again. This funding will provide support to expand 3 existing Pathways Community Hubs, and this funding will also provide support and replication for 3 new Pathways Community Hubs. Existing hubs must have been in operation at full capacity for no less than 3 years. They have to be serving the city in which they are located, or serving the county in which they are located, or specific zip codes. Those existing hubs must be certified. The 3 new hubs must be located in target services within one of the following areas: Cleveland, Columbus, Dayton, Lorain, Southeastern Ohio, or Warren. This data was based on the Ohio Department of Health's 2014 infant mortality county level data. Please understand the Commission will only fund for the development of 3 new community pathways hubs within 3 of the identified 6 areas that are stated in the bullet above. So we will not be able to fund every one of those 6 areas. We will only be able to fund 3 new hubs from one of those 6 areas. With regard to funding that will be available for the fiscal year 2021 biennium, in year one of the biennium, existing hubs will be eligible for up to $133,440. New applicants will be eligible for up to $100,000. Only one application will be accepted per agency, and the grant year actually begins January 1 of 2020 through December 31st of 2020. With all of our grants, funding is contingent upon the approval of our state budget and the availability of funds. Once that is determined, again, the grant year will be effective January of 2020 with an immediate startup required. So recruitment should begin for your program if funded once your countersigned acknowledgement of terms is received and your agency's budget is approved. That will all take place before January of 2020, because again, you'll want to be able to start up immediately, as in our next bullet, where the January date will mean the immediate hiring of staff in the first month and the immediate implementation of program activities no later than the second month of the first quarter of funding. So by February, you should be up, ready, and ready to go. As with all of our grants, this is a performance-based grant. So 2021 funding of the second year of the biennium, while non-competitive and only open to those who are funded, it is contingent upon your achieving the outcomes that you've described in year number one. And the Commission understands every objective of every goal may not be fulfilled, but the primary or a proportionate number of those objectives must be completed for your second year funding to be considered. And again, for the second year of program activities, they must continue without gaps in services, and they will begin January 2021 through December 2021. The Commission will not consider funding for the following proposals: those which seek funding to support residential services, or when treatment constitutes the primary service; those which request funds for the purpose of construction or renovation, or to conduct research or studies independent of service delivery; those which are legislatively mandated and funded by other public dollars; and those exclusively designed to conduct conferences or workshops. Those which operate or seek to operate as regional, hybrid, or lookalike hubs will also not be considered for funding. The submission deadline for this hub grant into the Minority Health Grants Management System, which I'll refer to as MHGM, is due by 11:59 p.m. on June 24th, 2019. Please know that any application or supporting documents, such as those that you've uploaded that come in after that 11:59 time period on June 24th will not be scored, because the application will close before midnight. Hand-delivered, faxed, mailed, and emailed applications will not be accepted, and there are no exceptions. So please do, with this new grants management system, please allow enough time to submit the application successfully in the MHGM system. So we strongly encourage you to allow enough time to have any of your questions asked and to have them submitted and responded to. There are times when we will have to submit those questions because they're systems based to OIT, and that will require at least one day to have that submitted and a response provided. So please allow time for that level of response. Please also note that the submission of the aforementioned technical assistance request will not change the application due date. That too indicates there will be no exceptions. To be considered for funding, priority will be given to grant applicants who develop services in accordance with the mission of the Commission. So to receive funding, applicants must demonstrate that at least 20% of project funds are received from other sources other than the Commission. Again, you must be a valid and active 501c3 designation status at the time of the application, and you will be required to upload a copy of that IRS letter that shows your 501c3 determination. Again, the exceptions to that would be a local health department or a city health department, or a regional health district. You'll be required to develop and establish a management board for the administration of the grant that's composed of a proportionate representation of the population to be served, and you'll need to submit that board composition with the grant application. You'll need to provide services in the minority community or in the extreme close proximity to the minority community, and you'll need to ensure that you meet all licensure and certification requirements of the state of Ohio. You must also answer all the questions listed on the administrative compliance form, which will be available for download in the application system. You will then upload that completed administrative compliance form. You'll need to comply with all current and applicable laws, regulations, rules, and administrative guidelines of the Commission. Those that are ineligible include the following: individuals, organizations that do not have a valid and active 501c3 designation status at the time of application. Again, the exception are local health departments or regional health districts, city health departments. Those that are also ineligible are national organizations. However, local chapters or affiliates of those national organizations may be eligible if they meet the definition of a community-based health group. Organizations applying for the sole purpose of acquiring funds to supplement existing programs, but they don't plan on enlarging their scope of work, they are also ineligible. Those that are also ineligible include organizations in the process of creating or starting a community-based health group just for the purpose of applying for these funds. And finally, those that are not eligible are regional, hybrid, or lookalike hubs. Critical elements are listed in the RFP, and those are intended to be and are considered grant participation requirements. While I won't read each of these verbatim, they will be available to you in the RFP and at a different time that you're able to play back this webinar at your leisure. The Commission on Minority Health expects successful applicants will be able to meet the following grant guidelines. The first of which is that all grant recipients who are awarded must have a fully executed acknowledgement of terms to include original signatures, as well as compliance with all identified program and all identified fiscal special conditions within 60 days of grant notice. The AOT will be provided to the grant recipients after the awarding of the grant. So you'll have plenty of time to receive that AOT, review your program and fiscal special conditions, respond to them, and then send that back to the Commission so that we're able to review them and hopefully approve them upon submission. And then Director Dawson will countersign that document. You must also be able to attend a grant startup orientation for the hub training, which will be in Columbus on or around the date of November 6th. Please abide by all state of Ohio mileage reimbursement documentation that's listed herein, and that cap for mileage in the state of Ohio is 52 cents per mile. If awarded, all agencies must agree to enter their data into the Care Coordination System, otherwise known as CCS, that was specifically developed for the Pathways Community Hub model. For more information on that, the website is listed. Costs related to the CCS system are estimated to and allowable up to $25,000 per year, and that's prorated as needed. Again, this is an allowable cost. All funded entities must provide the Commission's program manager and our director of our research enhancement or evaluation enhancement program must allow us access to your data. We will have access upon your grant approval in that we are able to log into the system and see all of the de-identified data for the purpose of reporting. So to that end, all hubs must track, monitor, and report your data in that CCS system. And it must be done so on a weekly basis to include cleaning that data on a weekly basis. There may be duplications or omissions. The reliance on this data is critical. So we have to know that the data has been entered correctly, but given that we're humans, that it's also being reviewed for errors and corrected on a weekly basis. At a minimum, because this system is immense, We will request that you report on individual total births by race, ethnicity, trimester, the total births by birth weight, and preterms by birth and race and ethnicity, and trimester of enrollment of mothers. This is because we're seeking to show that we're making an impact and reducing health disparities and infant mortality for minority moms. So it's important that we're able to document all of this data by race and ethnicity. All grantees must provide, as we typically have had, a quarterly report. That includes a fiscal report, a program report, and evaluation. That evaluation report must show the relationship between qualitative and quantitative outcomes. So you must have an evaluator for this grant. They do not have to be one of the listed REAP evaluators, although you are welcome to have one of those evaluators come on board as your evaluator. It's not a requirement for this particular grant, but what is a requirement is that you must have an evaluator. All hubs must participate in a monthly statewide hub call on a standing date that you'll receive in your AOT. For those that are existing certified pathways, there is a list from A through I of items that you must adhere to. You must have resided, the most important, in the cities of Akron, Cincinnati, Mansfield, Youngstown, or Toledo, as those are the locations that have present certified pathways community hub models. You must coordinate with the commission to provide our hub orientation training. You must agree to mentor an assigned new hub. You'll need to establish ongoing regular communication with your mentee hub. You'll need to expand your service delivery within 1 month of funding. You'll need to, of course, provide your Pathways Care Coordination services within 1 month of funding to your targeted population. And you'll need to expand staff as needed within the first month of funding. And you must also continue to use community health workers to help achieve your improved birth outcomes. And finally, you'll need to provide 1-year follow-up for each baby born into your hub program to document that our program is making an impact and allowing our mothers to have healthier babies that live to 1 year old and beyond. New hub grantees must participate in our hub model orientation training. You'll need to implement recruitment and hiring of staff within the first month of funding. You too will need to utilize community health workers. And you'll need to understand that you are able to hire, not yourself, but your community, your care coordination agencies can hire community health workers that are not yet certified. That way they're able to begin working with your hub, but you'll need to coordinate with that community care agency to ensure that your hired community health worker, again, hired through your community care agency, that they complete their training within approximately 6 months. And there are agencies who actually work with other funded entities to provide that training at no cost to community health workers. So please do investigate those options as well, where funding is available to help provide that training for community health workers, because ultimately all community health workers must be certified through the Ohio Board of Nursing. New hubs will be expected to adopt and implement the Pathways Hub model within 90 days. And you are able to begin the certification process within 6 months. Related costs to the certification process are allowable up to $15,000 in year 2, because you won't be certified in year 1, of course. And then you're able to visit the PCHI hub for more cost information. I will show you that website momentarily. You'll need to apply for certification no later than June of 2020 and obtain certification no later than June of 2021. You'll need to understand that applicants that are identified, new Pathways Community Hub applicants and your identified hub care coordination agencies must agree to replicate the model and participate in the hub model training and mentoring process. You'll need to participate in ongoing communication with your assigned mentor hub, and you too will have to provide 1-year follow-up for our babies. All grantees must comprehensively address the reduction in known risk factors among high-risk pregnant women to include the implementation of all 20 pathways. Those 20 pathways are a list of social determinants that have negatively impacted the birth outcomes for our mothers. They include things such as lack of insurance, transportation issues, a need for job training to have um, uh, childcare, things of that nature. But there are 20 of those that the hub will track. I will again show you where you can locate that list on the PCHI website. All funded grantees must participate in the Commission's Minority Health Month Expo activity uh, in 2020 and 21. This is our kickoff to April as Minority Health Month. We do a statewide kickoff in Columbus, Ohio in the Vern Rife Center. Next year's Minority Health Month kickoff will be on or around March 24th of 2020. And again, you'll need to create and maintain a Community Pathways Hub advisory board. And that advisory board should also, in addition to having a proportionate number of individuals that are from your community, you'll need to make sure that there's at least one member who has received services from a Community Pathways Hub model, because she has been in the situation where many of your mothers are. She's received those services. She's been able to overcome those social determinants of health and have a healthy child. Or she may have an unfortunate story of loss due to lack of having those needs met. But it's important to have at least one member who's received services. Please do try to have more than one. It's imperative to have, it's imperative to be able to have that feedback for your board. Each existing hub must deliver services to a minimum of 100 at-risk women in the first fiscal year of the biennium. That means that at a minimum, to ensure that we're getting at moms at the earliest portion of their pregnancy, at least 50% or 50 of those women need to be enrolled in their first trimester. 30% or 30 need to be enrolled in their second trimester, and not more than 20% need to be enrolled in their third trimester. And again, you are not going to turn anyone away who has a need for services, but you really are working with community organizations that have the earliest contact with moms as they begin to become aware or know that they are pregnant. That first trimester is critical to begin those preventive health services. Each new hub must deliver services to a minimum of 50 at-risk women for the first year in the biennium. So 50% or 25 of your women must be from the first trimester. 30% must be in the second trimester, and no more than 20% should be enrolled from the third trimester. In the second year of the biennium, each existing hub will be stepped down because your funding will be flip-flops. As you can see in the RFP that I will show you, your funding will decrease and the existing hub, the new hubs will increase. So each existing hub will be expected to then serve 75 at-risk pregnant women with the same 50, 30, and 20 percentage in the trimester of delivery. Each new hub will be bumped up to serve 100 at-risk pregnant women. And it should say fiscal year 21, please forgive me. And that's 50 women should be in their first trimester, 30 should be in their second trimester, and no more than 20 should be in their third. And forgive me, for item number 16, it should say fiscal year 21 and not 19. Prior to submitting your proposal, please be aware that you'll have to, your grant reporting mechanisms and evaluations report must be submitted on a quarterly basis in our system. And you will also be expected to submit, this will be outlined in your AOT, an annual program evaluation report and a 2020 annual program report, and additionally a 2021 biennial report at the end of the biennium. Also, please know that prior to submitting your proposal, you'll need to be aware that services must be one of the aforementioned counties, as we previously covered, or a specified targeted area within those counties. So that might be a census tract or a zip code, or areas of the like. But there are also the opportunities to serve a contiguous small geographic area of a contiguous county. So it may be that you live in an area that you live right on the county line, and you live in an urban community that has the service capacity, and just on the other side of the county next to you, they may not. So they automatically, for anyone comes over to your part of the adjoining county or contingent, or forgive me, Lord, the contiguous county to receive their services. So you're not serving that whole contiguous county, just a small portion that does actually come to your county to receive services. So again, it might be, several zip code areas in the county immediately adjacent to you. And again, regional service areas are not permitted. With regard to accessing the system, we do have a pre-recorded MHGM technical assistance session that was provided on May 15th. If you go to our website, you'll be able to access that particular area. So I will leave out of this now and go to show you on our website. So you'll go to the Commission's webpage. You will scroll down to grant opportunities. Once on this page, you will scroll down to the actual hub funding. So you'll scroll demonstration and lupus. Here we have hub. You can see where you were able to register for that training on May 5th, that was held on May 15th. You can access the training by clicking on this link. Or if that doesn't work, you can cut and paste the link into your browser. The applicant user guide, to which you will need to have readily accessible as you're filling out your application in the MHGM system, is accessible by this link. You must register as a user in the system before you are able to implement an application. You will do that by clicking this link. You'll need to establish yourself as a user. You will also need to create your organization in the system. You cannot start an application without registering yourself and your organization. And you will do that at this link where it says user registration link. Once you have established yourself and your organization, you'll be able to click on this link to access the MHGM application system and begin to enter your application. To access the RFP, you will click this link, and the up-to-date, accurate, revised RFP will be located at that link. Or forgive me, this is the link for that is right here. The RFP technical assistance will be right here on this link. So we have that available for you. So now I'll go back to our, okay. And I just showed you how to get to the information. Responses to this application should be prepared by, again, following the guidance that's provided to you in the RFP, but you'll, again, also want to make sure you have that applicant user guide. Please note proposals that don't provide all of the requested information or don't meet all the requirements specified in the RFP will be determined incomplete and will not be scored. They'll be disqualified. They will not be scored. And again, you'll be able to find the applicant user guide where I showed you. So I won't repeat that slide. Now we'll move into the actual application sections of the system. There will be for those of you that are familiar with our application on paper in years past, we had a face sheet that included organization information. You then moved on to your project abstract, project narrative, and so forth on through the list. These areas have been revised structurally in the MHGM system, but they are still there. So we'll begin to review that portion of the system. I'll now exit this again and go back to show you an example of the system. Okay, so here we are in the OCMH portal. I would have already logged myself into the actual system, so yours will look a little different. And since I've been on the webinar, it may ask me to log in again. So this is what you will actually see is this login area. So you will log in using your established username. and then I'll log in. It takes it a moment, so be patient. We'll just wait for this to log in. Okay, so I'm going to show you what an application actually looks like. So I listed in this system a pretend hub. This is not a real hub. It is just a hub to show you the actual portions of the system. So the name of my agency is Everyone's Health Matters, because it does. So we're going to go with that application. And so now I'm going to say, select the address, because once you've established your agency in the MHGM system and you select your organization name, when you go to the address box, only your address will populate. So then you'll click on Load Applications. You'll then scroll down where you're able to see your own application. Please know that the system will automatically generate a grant number for you. What's also important, note the fiscal year. It says fiscal year 2020. While you are in your application, you'll have a drop-down menu that will ask you which fiscal year you're applying for. If you mistakenly click 19, the proper information will not populate and you'll be stuck on that screen. So it's very important to choose fiscal year 2020. So let's go into the application. Here you can see all the sections on the left-hand side of the page that were just listed on the slide. Your face sheet, organization information, project abstract, proposal narrative, staff description, method of implementation, project application, or project action plan, forgive me, your line item budget, project documentation where you have the opportunity to upload items that you could not anywhere else in the document. There's signatures that are required, and then you're going to hit submit. The grant approval is on us, so we'll review your grant once it's received. So here we are on the face sheet. So you'll put in your organization name. Well, your organization name will already pre-populate, forgive me, because you have already registered your organization before you get to this application phase. So that will be pre-populated for you. I entered my fiscal year. See how I told you there's those previous years? You'll want to choose fiscal year 2020. You want to choose the grant type as hub, because here's all of our grant types, but just make sure you choose hub. Then when your project area is selected, only hub will be available for you to choose. Your application number will have already automatically been generated, forgive me. And your requested amount for year one, because I'm a new hub, is only 100,000, so I placed that right there. Then you begin to answer the questions. How many years have you been providing services and been in existence? I said 1 to 5 years. Your program title, I just put an example, but you're able to put in your program hub title. Then you'll fill in the obvious, the name of your executive director, your project director, and your fiscal officer. Project lead is going to automatically be filled in by the system. That will be Commission on Minority Health staff. Once all of this has been filled in, you will move on to the next page. So we'll scroll down and we'll hit next. This page will be pre-populate for you with information about your organization. You'll also note your congressional district, which is right over here. For your information, we send your notice of award to those that are listed in your congressional district. This also just is general information, your employee or your federal ID number. You will then click next. So this is your organization information. You'll now move on to project abstract. So just for sample text sake, I just put in some text here. You'll notice as I'm typing in the lower left corner, there is a character count. You have 5,000 characters for your project abstract. This is just a quick overview of what your project is and what it intends to do with its goals and objectives. The character count is different than word count, so don't count words. It is specifically a character count. So what you may do is, if you'd like, just be able to type your synopsis, your summary in this box, or some have gone so far in the testing as to have their project abstract already typed, and they cut and paste it into this box. That way you're just able to tweak it and get it down to 5,000 characters, or you're able to type freely in this box. But this character count will keep track of how many characters you have remaining. So I type my project abstract and I click next. Here I'm in proposal narrative. So I'm looking at my health area. I'm only focused on infant mortality, so I check the box. Demographics, we have to focus on all the minority populations. So you could quite literally check all these boxes, or just the ones that are, African American, Native American, Hispanic, Latino, and other. Um, and of course, no one, again, is turned away for race and ethnicity. So in my application, since I didn't check everyone, I put any individual or multiracial combination of at-risk mother as listed above. No one will be turned away based on race and ethnicity. So that way you're able to see who my target populations are. And then here we have gender. Of course, we are looking at risk mothers. Males are not ignored because there may be time for family members to take part in the community health worker visits with the mothers. Be they grandparents, aunts, uncles, the baby's father. They have an opportunity to take place in that community health worker home visit, but that's just not the target of our grant. It's for females, and you do your own selection of the birth years, mothers that are in the birth age range. Then I put in my description of my applicant agency. So remember, this is just general example. All my boxes will just have sample writing. And where I click on this, again, you'll see that character count leaves you a character down here. And I believe this character count for this box is 3,000. So pay attention to that characters counting, because you don't have a lot of space. Be as brief, but yet as descriptive as possible. Here I began to talk about my planning process. Here I answered the question about being a neutral entity. And in this question, it says, provide a description of how the newly certified hub is a neutral entity. Please know that that also means new hub. So just a new hub, because you won't be certified yet. And this new system, there was a lot of taking the old RFP and putting it in this new RFP, and that was old language. So this question does pertain to new hubs. You will not be certified, you are a new hub. Answered the next question about infrastructure discussion. I answered some questions about promoting collaboration. I answered some information about planning my directors, hiring, statement of competencies here. And then this question really asks for you to provide documentation of your signed memorandums of agreement. You cannot upload from this page. I will show you where you can upload those documents later on in the application. I answered my mission and vision question. Again, with the transfer of this new grant, this second mission and vision question is a duplicate question. You do not have to answer this question. You can simply put, so that the application will let you continue, duplicate question, see previous response. I'll put response here. You don't have to say duplicate question. See previous response. If you do answer this question again, that's just fine. It won't count against you. If you provide this duplicate question, see previous response, it won't count against you either. This question beneath it with regard to description of the community, this too, forgive us, is a duplicate question. I can't take this question out. It is hard coded into the system. So please forgive me, or I would take it out for you. But it too is a duplicate question, and it contains language that is not appropriate for this grant. So you would answer this question to provide a description of the community the hub is or proposes to serve, is serving or proposes to serve, and that geographic area is a census tract or a county or a physical address. If you're doing a group of communities, so you'll provide that description of your communities there, your problem needs statement, your zip codes, your target population narrative, and existing issues narrative. You'll also see at the top of my screen a session expires box. You have about, I believe it's 15 minutes or a half an hour, forgive me, of time per page, or 15 minutes. It will give you two 15-minute intervals to complete this page, so a total of a half an hour. As long as you are actively typing, the information on your page will be safe. If you allow the time to expire, you'll receive a message on the screen that asks that if you'd like to continue and save your information. So if you walk away and your page times out, you'll be provided with another box that will allow you to save the information that was listed on that page so you don't have to start all over. But the premise is to remain typing on the page. If you must leave the page, leave the application, always seek to save your information by clicking Next, and it will give you the opportunity to do so. There was one last item on this page, and that's selecting your elements of sustainability. So, of course, I'll click on this to show you. I clicked on alternative funding, and that could mean, grantsmanship, a federal grant, a city grant, a partnership, whatever that is. You put that description there, so that will show up on this screen, because we have to talk about how you intend to sustain your hub beyond commission funding. So since my page is now complete, I still have plenty of time up here in my timer box. I will hit Next. Here's where you will put your staff description. So describe your agency's plan to ensure assigned staff are culturally and linguistically competent is the first question. So you'll type your response in this box, and again, you will have the characters remaining. Then you can click on Add Staff to add your staff. So I'll just put in just some general information, and I won't do this for each box. It would take you too long. Age group, let's just say I'm 20 to 24. Let's go there today. My race and ethnicity, I am African American. I'm a woman. I'm going to be, this is our staff, so I'm employee. Staff qualifications, I'm just going to put master's level education in health education and minority health studies. If I could spell. Ignore that spelling. You can click on that and spell correct. Oh, it didn't do it this time, so we'll move on so I don't mess up our time today. So that's complete, and then I'll click Save. As you begin to enter your staff, and again, just the staff that are going to be on your grant, they will be listed just as my name is here in this sample. You see my timing? I'm still good for timing. I'm going to click Next. Here, we're going to be asked to provide a comprehensive narrative describing the proposed activities. This is your method of implementation. You'll have plenty of space here to type. You have 3,000 characters for each box, I believe. Let me click Type. Yep. But you want to be as brief yet as fully descriptive for these questions as possible. So this particular section, you would go through and answer all those questions as we did before. And so I won't read each of these questions to you, but these are the same questions that appeared in the previous Hub RFP. Once you are done completing these questions, you would then hit Next. I'm not going to hit Next because I want to show you the other sections. You would then go through, because once I click this next section, all my information on this page will not be saved. So please know that. You will want to finish a section and hit Next to save it. Then you go on to Project Action Plan. And here in the Project Action Plan, you formally had to state that you're going to complete Goal 1, and then physically type out each of your goals and objectives. For this purpose, I'll review how you complete the Project Action Plan in this system. So I'm going to click on Review. What you'll see here is that this particular application has all of the goals and all of the objectives already loaded into the system. You have to do all of the goals and each objective. The application, by virtue of this being one system for all of our grant types, will tell you that you must choose at least one. For this hub model, since you're implementing it with Fidelity, you must select every goal, and there are 3, and every objective. So you can see for goal number 1, I selected every objective. For goal number 2, I selected every objective. And you can see my application is not complete because it says you have not yet supplied details for this objective. But I wanted to show you how I selected each goal and each objective for all of the goals and objectives. So I will now go back, click done. Okay, so I want to be able to show you how I did that. So when you first open the project action plan, it will show you the means by which you complete the project action plan. So you're first and you're defining your project model. So your model type, you're going to select evidence-based because the hub model is evidence-based. For your project model, the only thing that will come down will be Pathways Community Hub model. You select that. The description will already pre-populate. You won't be able to type in that grayed out box. Your type of interest will, of course, be access to health services for our pregnant moms. The start date, as was shared earlier, is January 1st, 2020. The end date is December 31st, 2020. You then, if you're going to need to leave and you can't complete the application, you'll hit save and finish later. For the purpose of this demonstration, I'm going to hit next section. You're now going to define your goals. This is what I was referring to earlier. It says choose desired goal or goals for this project model, at least one. No, for this model, you have to choose all of the goals. The asterisk, as you'll see, in this particular grant system means all are required. So you must select goal 1, 2, and 3. I'll now move on to the next section. I then define my objectives. I have to use all the objectives for goal number 1. I'll move on to define my objectives for goal 2. You have to select all of these objectives for goal number 2. I'll move on to goal number 3, and here are all the objectives for goal number 3. I'll now move on to the next section. This is where you will put in the numeric portion or the degree of change you intend to see in your objectives. So say, for example, you have 10 employees in your hub, the administrative portion of your grant. So in this first objective, it says in this grant year for the objective listed above, which is the number of staff persons that the hub projects to train in the hub model orientation. This is for the goal. The goal for the current objective is replicate and expand the pathway. So we know we're in the right goal and we see your objective. You'll now go down here to let me know how many of your staff members are going to be trained. So in this grant year for the objective listed above, 10 staff members out of 10 will be met. That means, because again, for this system, it has to support multiple grant types. So the sentence will not read as you typically will put in an objective, but we're looking for the numeric or the degree of change amount for this particular objective. So you have 10 employees and you intend to train all of them because that's required. So in this grant year for the objective listed above, 10 out of 10 employees, that'll help you keep it straight, will be met, or will be trained. You are unable to change that objective language. I'm reading it the way that will help you understand what that numeric objective means as it's written, because it's not written in a way that would absolutely reflect the sentence above in your objective. But that's how you would read and complete that particular objective. Where it says choose your level of change, those are individuals. And so you'd click individual. And then it's going to say the linkages between the program design and each required goal and objective the program intends to achieve. So this is asking you to tell us how this particular objective will help you reach your ultimate goal of reducing health disparities. So I put in a generic response here. And so then what you would do is then go on to the next objective. And you would proceed this way all the way up through every goal and objective. And it's pre-populated for you. You don't have to retype anything except for your number, whether it's individual or family. And yours will always be individual. You're not going to do any group education because you're always focused on the mom. It may be that her family is there, but you're focused on that mom. So your level of change will be individual for your goals and objectives. But you would do this for each of the defined objectives for goal 1, goal 2, and goal 3. So I'm going to save and finish later so that we can go back to the application. So next, after you finish all of the 3 goals and all the required objectives, your next section will be the line item budget. You'll notice at the top where it says the total of your other amount should be at least 20% of the total commission request. If you scroll all the way to the bottom, this is your other, this is your 20% match. So as you're filling in your budget, we've already got all the line items in there for you. You're able to implement or to note what your match is in this section. Or I'm sorry, if you're able to name another section, forgive me, here, and your direct costs. And then here is your other box here. You put in what the totals would be for each of these quarters and your narrative for each one of the line items. So in this particular line item, you still have a lot of characters for personnel. There's no way that we anticipate you need 3,000 characters for this narrative. Please don't attempt to use 3,000 characters. It's a quick and easy place for you to put the narrative of who your personnel are. So you put that in that box. And this is further described in the grant application user guide. So you would enter your line item budget. And at the bottom of the page, if all of this is entered right, you won't have any warning signs on the page. You'll be able to click next. So for the purposes of application, I'm just going to go back to the different sections. Project documentation is where you upload items that are needed for this RFP, all the required documents. So you'll see over on the side here, all your required documents for your hub model have an asterisk by them. Here we have some that are available for download because these you wouldn't perhaps have at your agency. So it's the Civil Rights Form, the Rehabilitation Act form, and the W-9. All of the rest of these you would upload into the system. Again, keeping in mind you want to put in all those that are asterisks, have asterisks beside them. So you would come over here, you'd select the document type, and you'd go down the list and you'd find that item, and then you'd click on that type. You describe what it is, and that is your nonprofit status. You type that in, status letter from IRS. You'd put in who your REAP evaluator is, and then you'd go find that file. Of course, I don't have one in here, but you'd find that file and upload it, and then you'd upload attachment. And then this same box would open for you again to do your next item. So you would go down this list and put in all of the asterisk items for the hub model. So here again, I will go back to this side of the application to show you the complete application. You'll next move to signatures if it will allow me. Here we go. It's kind of slow today. These are the grant signature sheets. These are the roles that each one has been assigned in the grant, and where they have to check the box that they agree. By checking the box, you indicate you agree to submit the RFP, so they're agreeing to that. They'll check the boxes, and then you'll hit next. Then ultimately you'll submit. This is not going to let me submit because I don't have all the grant completed. So I won't hit that, and we'll get an error message, or I could hit it so that you could see that it's not gonna. So if I tried to submit from this section, and it might be doing this because I'm in the administrator side, it's not going to let you submit an incomplete application. So you're going to want to make sure that all the sections are complete and all of your uploads are in there. Because if we get an application that's not complete, the same thing will happen as did on paper. We won't be able to review your application. So you'll want to make sure that you do that, because once you hit this part of the screen, you will be done after you've submitted. Also, notice up here on the screen, my time kept starting over my 15-minute intervals of the full half an hour I have for each page, because I never stopped, typing. I was always active in the system. Being active in the system is typing, it is hitting the space bar, it is moving the cursor, it's toggling between pages. So that activity will keep your grant um, from locking you out and having you to log back in, potentially losing your data. Always follow the prompts on the screen. So that is the application portion of the grants management system. It's really straightforward. It's really easy to use. The biggest piece is to make sure that you register yourself first as a user, then you register your agency. Then you can go in and begin to complete the application. So now I will go back to, what I also wanted to show you was where you could find out more about the Pathways Hub process and what it is and who it serves. Here is the website up here in the corner, the left side of the screen. It'll tell you about who the hub is, the hub process is rather. You'll have information about that. You'll have information about those. You can't click on these, about who registers, how they connect, how it's monitored, and how it's tied to payment. You can go to the hub model overview. It'll give you information here. You can go to the hub certification process, and here's a whole litany of items that are needed for the hub certification process. So that is where you will find that information. And then with regard to certification fees, because you want to build those in for your year number 2, not the first year, but this is where you'll find the up-to-date information on fees. So that's the resources from the PCHI website. I will now go back to our webinar. So that is the system. If you have questions, I'll let you know where to send those. This is telling you about the session expiration date that I just showed you, where the timer is counting in 2 15-minute intervals for a total of a half an hour per page. But in any case, this outlines that process for you, because you're going to want to make sure that you save your information so you don't have to start a page over. I cannot tell you how much time went into this save feature. So please make sure that you, as you get prompts on the screen, if you do time out, please follow them, because there are ways to save your work in the system. And they are also outlined in the applicant user guide, as well as a quick tips here. Some more system quick tips. Click the next button to save and advance to the next section. I reviewed that in the system. Fields with red asterisks, it's a hard word, are required to be answered before advancing on to the next section of the application. And remember, that's going to be especially important when it comes to uploading your documents and in the project action plan. You must address every goal and you must address every objective. And remember, character counts are a part of this entire application, and it's not a word count. So this kind of gives you the overview of how many you have per section. And then this is the best part. I'm so excited about this part. So aside from the fact that you have required grant reporting outcomes and participation requirements, formally, you had to submit your quarterly reports on, well, you filled out a PDF form, you submitted it electronically, and then you submitted it on paper. Your quarterly report format will pre-populate with your grant data from your objectives. So it will ask you to put how many people you have served per objective in the quarterly report. You don't have to retype it. You'll just type in some data about what went on that quarter. It will automatically pre-populate your grant information from your organization, your roles and responsibilities of your program director and your fiscal officer. Your budget will pre-populate from your approved grant. It is awesome. So it'll be so much easier and less time consuming for you to report on your data in the grants management system. So the only things that you may upload would be your evaluation report. Your evaluator's report is really all narrative. So they won't be in your program report section of the system. They will have a form as the evaluator to fill out those same qualitative and quantitative questions, provide that discussion, and then you upload it into this grants management system. Otherwise, all of your reporting is done in the grants management system. So it's phenomenal. So again, just a couple other participation requirements. Make sure you have a program evaluator. Make sure you understand you have to take part in the Health Expo, the Minority Health Month kickoff every year. It'll be in March. Next year's is March 24th. And make sure that your program director and your program evaluator participate in face-to-face meetings, or webinars, or conference calls as needed throughout the quarter. Your evaluator is not there just to summarize your work for your quarterly report. They must be a part of your discussion around your report progress, because you may see that you are not hitting the mark with regard to your first quarter moms. So your evaluator may look at what qualitative data they have with regard to what community health workers have shared as an issue with reaching moms in the first quarter, and compare that with what the data shows, and you may be able to tweak with the frequency and the location and so forth of how you're reaching these moms, but only because there's been communication between yourself, your community health workers, and your evaluator. You can, without tweaking the integrity of the program, tweak how you are addressing that objective to better reach those first quarter moms. So the intent is not to have an evaluator just for reporting purposes. They are an integral, ongoing component or part of your program implementation team. All of those people, your program director, your evaluator, are to also have touch base time with your REAP panel evaluator. Dr. Joanne Mawasha, who is the director of our research evaluation program, there are a level of panel members or REAP evaluators that are assigned a hub to review. So your REAP evaluator may need to touch base with your program evaluator from time to time just to say, how are things going? What's the data looking like? Should there be any discussion around objectives that are particularly difficult to achieve change? I mean, it's just a high level, making sure the grant's being evaluated properly, hitting any touch points of things that might need to be discussed, because that panel member may have some excellent insight for you and your program evaluator to help improve your program outcomes. So please also know that, prior to submitting your proposal, that you're going to have, of course, those grant reporting mechanisms that I just shared with you, and that grants management is required by your agency, and you should be responsible for the following. Your AOT will be provided to you after you're awarded funding. This is reiterated to you for this point because sometimes people have gone beyond that 60 days, and unfortunately they're outside of that 60 days and the grant is gone. So this is so serious in that you want to make sure that you get your grant AOT and your program and fiscal special conditions addressed before that 60 days, so you're not forfeiting your grant. And then making sure that you submit your program evaluation and quality reports on time in the system, and to ensure that your program evaluator reports are reviewed before you submit them. So when I spoke earlier on making sure your program evaluator meets with the program director and the community health workers with frequency, or however you determine what that frequency is, as long as they meet throughout the quarter. You're going to want to make sure that that report that they are submitting to you for the quality report is reviewed. Make sure it matches what the data says. Make sure it captures everything that has taken place in that quarter. It's not going to be a cut and paste of what you're submitting for your program report. It's going to be a qualitative discussion of the data that has been submitted. So yes, they'll have data in that report, but they're going to give the story behind those numbers as to how that outcome for that particular goal area was achieved. So it's really important not to just do a cut and paste. I will ask for more follow-up questions if that's the case. So make sure that's qualitative and quantitative data supplied in your evaluation report. Just a reminder that the due date for your grant is June 24th. And again, 11:59 on June 24th. Midnight the system will shut down and your grant will not be reviewed. So that is the end of our Hub technical assistance session for the RFP. I hope this has been helpful. Please submit questions to minhealth@mih.ohio.gov. That's MINHEALTH at mih.ohio.gov. That is where you submit questions about the RFP. That is also where you submit questions about system issues that may not be operating well for you. And that is where those questions will be responded from. Do not send those items to commission staff. Please send them to minhealth@mih.ohio.gov. So thank you very much for attending today's session. It will be saved to the website so that you can go and listen or watch this at any point in time during your application process. We look forward to receiving your application, and thanks so much.